right, guys. I'm Nurse Erica, your host and advocate for healthcare workers and the labor movement. Before we dive in, if you love what I'm doing here, please consider becoming a patron of Nurses Uncorked. The link is in the episode description. Your support keeps this show going. I try to limit the number of advertisements, so it really do depend on outside patron support. Today, my guest is Bob Funk, the creator of LaborLab, which is an amazing resource that I am so excited to tell you guys all about. We'll be discussing union organizing, union busting, finding out how much your employer is spending on union busters, strikes, and my favorite subject, scab nurses. This episode is jam-packed with information. Welcome back to Nurses Uncorked.
Welcome to Nurses Uncorked, where I pour out the unfiltered truth about healthcare life. I'm your host, Nurse Erica, serving up real talk straight from the front lines to your ears. Each episode, I'm uncorking conversations that matter to nurses everywhere, from the hilarious to the heartbreaking, the inspiring to the infuriating. No filters, just authentic nursing experience shared with a splash of humor and a dose of honesty. So grab your favorite beverage, put your feet up, I know they're tired, and join me as we uncork another episode of Healthcare Reality. Now let's get this shift started.
This week, I am joined by Bob Funk. He is the executive director and founder of LaborLab, an organization that he established in 2021 to empower workers to organize, secure robust contracts, and build enduring collective power. Under his leadership, LaborLab provides essential education, strategic research, and public mobilization to counter sophisticated union busting efforts. Yes, guys, we are going to be talking all about union busting today. Bob Funk's vision for LaborLab was born from nearly 2 decades of experience as a strategist for labor unions, federations, and advocacy organizations across the U.S. Throughout his career, he witnessed a profound information balance in the workplace. While employers have access to high-priced consultants and a complex playbook of anti-union tactics, workers are often left in the dark. Driven by the need to close this gap, Bob founded LaborLab to level the playing field. By exposing the clandestine tactics used by labor relations consultants and providing workers with actionable data, he ensures that those seeking to organize have the transparency and tools necessary to fight back and win. Welcome, Bob.
Thank you so much for having me, Erica. Obviously, big fan of the program and the advocacy that you do. So thank you so much for having me on and the opportunity.
Well, I didn't give you much of a choice because I kind of stalked you online until you responded to me.
Well,
I
it was
got desperate
appreciated.
and started commenting on your video saying, hey, I messaged you.
Yeah, I apologize about that. We're a small team, and sometimes we miss the DMs and social media.
I actually came across you from a couple TikTok videos you had posted that were from a recent testimony you gave before Congress. And it was amazing. I thought, this guy gets it. This is absolutely incredible. And so then I had to bring you on the podcast. But what was that testimony that you did? And what was the outcome of that?
Thank you so much for those kind words. So I was invited to testify in front of the House of Representatives Subcommittee on Health, Education, Labor. The hearing, I was the lucky one person that was there on behalf of working class people and unions. I was testifying alongside a number of other individuals that were there to criticize the labor movement, despite it being incredibly popular, one of the most popular institutions in the United States right now, and not a lot is very popular. But I was invited there to talk about a piece of legislation that is really underappreciated within the labor movement itself. It's the Labor Management Relations and Disclosure Act. And it's a really,
LMDR.
you got it. Yeah. And I say this as a strawberry blonde, but we refer to it as the redheaded stepchild of the NLRA. It's a really important piece of worker transparency, and it's both sides. Like workers have a right to know how their unions operate, how the funds are spent. Strongly believe in that. Strongly believe in democratically run unions. That part of the law is very, very well enforced. Overwhelming majority of unions comply with the transparency and disclosure laws. What has been lost intentionally in the process over the last 50 years is a complete negligence from the Department of Labor to enforce the other two aspects of the law, which is employer transparency and union buster transparency. Workers are entitled to know what their employers are doing in an attempt to silence them and squash their union drives. Additionally, they're entitled to know if an employer hires outside parties to come in and advise them and train them on how to union bust or directly start doing captive audience meetings, one-on-ones, surveillance. And the reason this is so important is because over and over again, we see union busters hired. And this isn't just coming from me at LaborLab. This is coming from the General Counsel for the National Labor Relations Board, where these union busters come in and directly lie or insinuate that they are simply neutral third parties. Answer
Neutral
their
my
que
ass.
Yes, exactly. I mean, they will come in and say, "I'm just here to listen to your problems. I'm here to fix your problems. Let me know what's going on." The truth is that when we actually get a hold of their contract, there are examples where they get a $25,000 bonus if they bust the union.
Yep.
Workers deserve to know this because not only are they being lied to or misled, but often union busters come in to surveil workers. So they want to create an environment
Spy
of
on us.
trust, but really all they're doing is then going plugging it into a spreadsheet and saying, "Hey, this is how we can leverage Sarah, and this is how we can leverage John to vote against the union." We've come across this so many times. There was a nursing campaign in Helena, Montana, my hometown, where union buster was hired, didn't disclose that they had in fact been hired. Luckily, we had a relationship with that local that let us know, "Hey, we've got a union buster on site. Do you know anything about this guy?" We filed a complaint with the Department of Labor, but what really is important here is that we also found out because this union buster had their spreadsheet where they were tracking nurses. Like they had examples of this nurse has bad knees, so she's going to be looking for retirement soon. This nurse has a disabled child, so we know that flexibility is going to be big for her, and that's where we can leverage it. But normally workers aren't aware of all of this borderline HIPAA violation
Yeah.
surveillance that is happening to nurses. The only reason we found out about that is because they accidentally uploaded the spreadsheet to the share drive. So when nurses walked in
Oh
and
my
they opened their
God.
share drive and they said staff notes and they opened it, and of course it was
Someone got
printed,
fired.
put in everyone's mailbox with, identifying information because at least nurses care about each other. So they got rid of the identifying
Right.
information. Luckily, because they goofed up so bad that Union Buster was fired. But usually
Thank
these folks
God.
operate in the shadows. I mean,
Yes.
going back, unions comply with this law. They simply do. This is not just us. Our research has been validated
Yeah.
by the Department of Labor itself.
Isn't it something, I'm sorry to cut you off. Isn't it something
Yeah.
like 86%, if I remember correctly, compliance rate from the unions reporting everything that they're supposed to do? Very high percentage compliance rate versus what was it, like 30 something percent compliance rate
Yeah.
from the employer, from the union buster organizations and the
Yeah. It's
employers?
literally the inverse of compliance.
Yeah.
Um, I mean, th th and the fact of the matter is, Erica, it's even worse than that because that's 34% of the companies and union busters and hospitals that we know should be disclosing stuff. That doesn't account for a huge majority of campaigns where no one even pretends to play by the rules because the Department of Labor's never done anything about it. So many times, if we're lucky, they will file on time. If we're like, but 80% of the time they file after the election, right? So they hold on to the paperwork until it doesn't matter anymore. And again, those are just the ones that are playing by the rules. We know that the vast majority of union busters and companies don't even pretend to comply with the law. So we're blowing up the numbers there by calling it 34%. I mean,
Right.
we are much closer to like a 10% mark here of compliance with the law. And
Yeah.
that means that a $1 billion industry is being allowed to operate without scrutiny, without accountability, and 100% in the shadows.
So, what he's saying, guys, to my audience out there is basically that the unions are doing what they're obligated to do. They are reporting where their money goes, where they're spending money on. They're transparent, right? But the employers and the union busters are not reporting anything. And so they're obligated, correct me if I'm wrong, to report how much the employers, how much they're spending on these union buster companies, right? And we'll get into some of that. But they're not. And imagine how valuable that information is. If you are working somewhere that is trying to organize, that is trying to unionize, if you could simply look up, because you're supposed to have access to it, how much they're paying this firm, these millions of dollars, $600 an hour in some cases per union buster, right? Imagine how valuable that information is. But they are simply not complying with the law and reporting it purposely because they want to cover it up, right?
Mhm. 100%. I mean, the financial part of this is absolutely huge. When an employer says we don't have the money to bring in new nurses or
Haha. Yeah.
increase pay, but then they turn around and they're paying a consultant $500 an hour. We documented one consultant that's getting paid $9,000 a day. I mean, that shows you where your
Jesus.
priorities are. I mean, you already know how far they're willing to go when it comes to bringing in outside nurses to fight strikes. Like they're willing to pay
Yeah.
them a lot,
Yeah.
but that
We'll get into that
pales
too.
in comparison for like the union busters. And then we also have to bring into account the law firm, the HR, if the CEO is getting involved in this. I mean, it becomes a full press activity. But outside of just the money, workers deserve to know why they're talking to this person. And
Yep.
often they just file paperwork that says, we're there to educate the
Uh,
workers. Yeah,
yeah.
you're not
I'm
there to
just an expert on labor relations. I'm here to just, inform you of your rights, or I'm just an employment attorney. No, these are all just code words and cover up for union busters.
100%. And
Now, I'm going to jump around a little bit because I didn't really start at the beginning of my questions, but since we're kind of on it, can you explain the persuader rule loophole that allows for some of these firms to avoid reporting their union busting activities, and how does this affect everything for us?
yeah, absolutely. The persuader loophole, we call it the advice loophole. The advice loophole is, I mean, you could drive a yacht through it and corporate America. Um, But what they do is, frequently, if a union busting campaign doesn't have like people that are in there meeting face to face with workers, they almost always have law firms advising them on how to bust the union. Well, these incredibly powerful law firms, the Littler Mendelsons, the Ogletree Deacons of the world, they have so many resources. They clearly think they're above the law. And so they just say, oh, we're providing advice. And so that's attorney client privilege, which actually is not how the law is written. And despite being high press lawyers, they're not very good lawyers. They're just good at working the system as it is, because the law is very clear that if they are training uh, management on how to bust the union, they should be reporting it. But the issue is that the law firms say that they don't have to report anything because they're just giving advice, which is a total abuse of the law. Literally have, as I talked about in my testimony before Congress, we have recordings of these lawyers in captive audience meetings, talking to workers, trying to intimidate them, following them around warehouses. And the lawyers just say, oh, well, we're above the law. We don't need to report that. We are obviously doing the best we can to bring them into compliance with the law. We report all of this with evidence to the Department of Labor, asking if the Department of Labor's done anything. They haven't. So that's why we are taking matters. The government has completely dropped the ball on this. And
Failed workers, essentially.
absolutely. And so we are simply trying to fill that public service that the government's supposed to be ensuring for workers. So these guys may not report anything, but we still have the information on them. And so as long as we get in touch with the organizing campaign or the bargaining campaign, we can provide that information, even if these people think they're above the law. But there is a solution to this. There is the persuader rule, which would have closed this loophole. It was proposed under the Obama administration. It was in place, got challenged, and it just never was brought back under the Biden administration. We do very much hope that if PROAct or something like that makes it through Congress at some point, the persuader rule has to be included in it, because this is a big reason that 90% of campaigns are allowed to operate completely in the shadows unless you get in contact with an organization like LaborLab and we can provide you with the background information and the data that you're entitled to.
Yeah, and let's talk about LaborLab, because I was doing a deep dive on your website last night and I signed up for a bunch of stuff, And it's laborlab.us, correct?
Correct. Yeah.
Okay, and I'll link that in the show notes.
Okay.
But can you tell my healthcare worker audience all about Labor Lab, what inspired you to create it, and some of the tools that are on there? Because it's
Yeah.
amazing.
Thank you so much. Yeah, so the genesis of LaborLab, especially during the pandemic, where you saw so many things coming together. The fact that, one, unions have never been more popular. Like, there
Yeah.
really isn't an institution in the United States that has more trust and support than organized labor, because we know that this economy is not working for us. We know that our government isn't working for us. We know that simply the system isn't working for us. Additionally, interest in organizing has exploded. So much of who's actually violating or attacking the rights doesn't get called out because it's either hidden, as we've been talking about, or simply inaccessible through the bureaucracy and clunkiness of bureaucracies, which we're very grateful for, but we are trying to streamline here, right? So we wanted to call out every employer that union busts. Obviously, that's a very big job to do. So we're getting there closer every day. But we decided that we really needed to start utilizing the information that was out there, the disclosures that were out there, the ULPs, and really start putting it all in one place so that when workers face a union busting campaign, they can get everything they need in one place to respond. The other side has been doing this for decades, and they have
Yeah.
massive budgets to weaponize data and information against working people. We're simply trying to level the playing field here, and it's incredibly important in the healthcare industry. There is no industry that spends more money on union busting as a whole than the healthcare industry,
Did you
which is
guys hear that? Did you hear that? Say that again, Bob.
there is no sector in this economy in the United States that spends more money on union busting than the healthcare industry. It's absolutely horrific. We all know that our healthcare system isn't working. So why is this sector spending so much money attacking the only people that most people actually relate to and trust when they're in a hospital? And hospital CEOs are absolutely on the wrong side of history and the wrong side of public opinion and the wrong side of morality, to be honest.
Yeah. And so on your website, on laborlab.us, you have something called a union buster tracker, which is amazing. Like, you guys, you have to check it out. This is amazing. Has documented cases across many industries, not just healthcare. But tell us how we can utilize that as a tool, how that works.
Yeah, the tracker's really powerful because every week we release new companies that we know have hired union busters. People want to know if their neighbors are being attacked by employers. Almost every week when we put out the report, we get feedback like, I had no idea that a company in my town would be union busting. And so it's not just the Starbucks and the Amazons of the world. This is literally in every state, every community. Around the country that otherwise, if we weren't making this accessible, they'd get away with it. So why we love people going to this is because they can actually start getting engaged in campaigns and engaging in solidarity, public support. Contact those employers in your community if you don't agree with union busting, which 75% of Americans don't. So you're on the right side if you say stop union busting, right? So that is just the starting point. Additionally, in terms of how you can use this stuff, is you work at a hospital and there's union busting there and you don't see it on the map. It's because they haven't disclosed anything. And so contact us so we can put pressure on the Department of Labor to actually get disclosure. But in the meantime, still get that information to you and your partners and your allies that tell you who these people are and what they're doing.
Yeah. Can you kind of touch on some of the most common union busting tactics that you've seen or been aware of hospitals and health systems deploying against nurses and healthcare workers? And has it evolved over time? I've been the victim of it. I have observed this firsthand, led a union organizing campaign. And so I understand how insidious it is. But I don't think that a lot of nurses and healthcare workers understand they're so good at what they do. They don't come in wearing a name tag that says union buster, I'm here to manipulate you. They're so good at it. And you believe them. There's a reason they're earning that insane amount of money because they are good at lying and manipulating. But can you touch on some of that?
Yeah, you're absolutely right on the tactics. I mean, there are two schools of union busting. There are the successful ones, and there are the ones that are still operating like it's, the 1930s. And those ones aren't
Yeah.
successful, right? The ones that go in there and bully workers, like very visibly, the ones that go in there and are incredibly aggressive are usually unsuccessful. We have union busters that we've caught literally attacking workers and trying to start fights with them, screaming homophobic slurs at them. Now,
My
that
God.
is easy to turn around on them, right? The
Right.
more insidious union, and that can like put a union busting campaign on its heels as long as the public's made aware of it. The most successful union busters have absolutely changed their game. And they come in and they say, I've been brought in by CEO X, whatever, and sounds like things are real bad here, and I'm here to fix them. So you tell me what's going on,
Which sounds
and I
great.
will. Sounds great. Finally, someone's listening to you. They're relating to you. We've had union busters that stood outside of a work site for 30 days without actually like engaging in any activity except for shaking everyone's hands as they came in and said, "Hope you have a good day. You got a coat for today?
My
Everything good?"
God.
Build that trust, right?
Jesus.
That's the environment that they wanna build, and then the workers start sharing information with them, and it is part of their surveillance, which then they can use in their campaign to find where, the leverage points are against people. They are collecting all of this information to find out where the union's weaknesses are and where the strengths are, who can be bent and broken, and who is a lost cause for their union busting effort, and it is so incredibly powerful. Beyond that, there's always attempts to turn different wings against each other. One wing that doesn't support and
Turn day
making
shift
it so
against night shift, unit against unit, nurses against CNAs. They try to turn us against each other. Yeah.
absolutely. Those are, some clear ones. In
And because
hospitals.
I'm sorry, I have to interject. The reason for that is because if we are fighting each other, guys, we are not fighting admin and the
Mhm.
union busters.
Right.
That's why they do this.
Yeah, and they don't care what your relationship is with your coworkers by the time they leave. They're just trying to beat an election and buy themselves a few more years so admin can continue to operate the hospital as they have. I mean, they're willing to go completely scorched earth. We have one campaign where the union buster was holding one-on-one, so he'd call in nurses, an empty patient room, and sit down with them and talk to them about the issues. This at a hospital where people were waiting for beds. Like,
Yeah.
they're waiting for beds and they're
Wow.
keeping rooms empty so that they can pull nurses in and say, "Hey, I just need 15 minutes of your time." Where
And
it's
that
already.
that should tell you, to the nurses out there, because management will fill that bed before you're ready, before it's safe, because that is dollar signs, right? So if they are holding up an empty room, an empty bed, that alone tells you how important it is to them that you don't unionize.
Yep, absolutely. Let me give you another example that they'll do is, we just had another nurses campaign out in Iowa where at the last second, they hired up real fast and tried to add a unit to the bargaining committee, and that's an attempt to dilute the vote, right? So
Yep.
it's like all of a sudden they find
They
money to hire a nurse.
manipulate the numbers.
Yes, to
Yeah.
manipulate because a new hire hasn't established and doesn't know the problems of the workplace, and they are the most likely to vote no on a union. They're grateful they just got a job, they don't want to rock the boat. That is one of the most common tactics as well, which again just shows how disingenuous they are. They can fix these problems that exist in the hospital. They're choosing not to, unless it benefits their power structure.
They'll also do it to manipulate the numbers and claim that, oh, new hires are not eligible to join the union, or a new grad that's still on their preceptorship not eligible. And it's nothing more than a manipulation and stall tactic. I witnessed this firsthand with my union organizing. They would try to say, well, that person went part-time, so they're not eligible. This person is per diem. They're not, over and over and over again. So every time we had a definitive count of how many eligible employees, because it was a very specific set of employees in this instance, they would come in and say, oh, well, that one doesn't count. This isn't an accurate count. This one doesn't count. You're not considering this. And it just was to throw us off, try to make us give up and bide time. I want to say also that the captive audience meetings, can you explain that to people who may not be aware? And And also, here's the thing, just like they don't come in wearing a name tag that says Union Buster, they're not gonna call it a captive audience meeting. They're gonna say it's a mandatory benefits meeting to discuss your benefits or some other made up, fluff. Can you tell us
Mhm.
about that?
Yeah, captive audience meetings are truly one of the most powerful tactics that union busters have at their disposal because there's really no other situation where you can force employees into a room to listen to whatever you want to tell them for hours. We were contacted by a campaign last year, an 8-hour captive audience meeting.
My God.
8 hours they spent in there. Now,
Imagine how tired you are. You get and they'll make you go after your 12-hour shift. That's what they did to us. And mind you guys, it's not even just once. Like it'll be every week, twice a week, every other week. It's ongoing and they mandate that you go to these things when you are tired on your day off or after you've worked 12 hours. So yeah, they keep you in there long enough, you get to the point where you're like, "I don't care anymore. I just want to go home, whatever."
Eric, I'm so glad you just brought that up because actually there's a phrase that we use that we adopted from nurses on this issue, and it's called alarm fatigue.
Yeah,
And we've because it was a nurses campaign that brought us this attention. It's like it's just alarm fatigue, and what I mean by that in union busting is a lot of the times one of their biggest tactics is to just simply exhaust you and make the environment so toxic that when you finally get done with your shift, the last thing you want to do is talk about work, nevertheless a union, right? Because you've just been forced into an hour-long captive audience meeting, then pulled into a patient room twice to talk about it again for 15. Then you're also getting texts about why you shouldn't be in a union. They're just flooding you into exhaustion so that you do not actually have the energy anymore to talk to your coworkers about what's going on. You just want to get back to whatever your job, which is already hard enough. And so
yeah.
this is not a I'm threatening you. This is an exhaustion tactic. Now, obviously, during these captive
Wear you
audience meetings,
down.
they'll lie and mislead and present with a lot of misleading facts. And you're about to like hand everything over to the union, which is like great because you are the union. The union is a democratically run institution. So you have control of it. If you don't like what's happening in your union, you can get involved and change it, right? But they will lie, mislead, present biased facts, cherry pick things, and on the other side, the workers don't have that opportunity. They can't bring everyone into a room for an hour and
Right.
talk about the fact that unionized hospitals have better patient outcomes than non-unionized ones. They don't have that opportunity. So you're absolutely right. It's misinformation, it's intimidation, and it's fatigue. Those are so powerful, and that is the real goal of a captive audience meeting. Um,
Yeah. That's a
yeah,
great
and
analogy. The alarm fatigue of union busting. That's a great analogy because
well, it
nurses
goes out to
will
the
get
nurses
that.
out there. I thought it was just such a perfect analogy for what their strategy is just harass the daylights out of you.
Wear you down. We've seen cases like Miami Valley Hospital, I believe that was last year, where nurses allege that they're fired or disciplined for their protected activity, union organizing. What should healthcare workers know about their legal protections under the NLRA, the National Labor Relations Act? And what do you recommend that we do when we face that inevitable retaliation? Because we know it takes place.
Yeah. The retaliation thing is really, really tough. First off, know your rights. That is absolutely one of the most powerful things. If you know your rights, that already puts you ahead of the game because
Yes.
when an employer starts breaking the rules and you can say that's a violation of my rights, that'll often send a message back to them. They're like, "Oh, hold on, do I need to like lawyer up or something like that if they haven't already?" If you go to our website, we have a number of resources about understanding Section 7 and Section 8 of the NLRA and how that protects your rights. Section 7 is basically the language that says you are allowed to talk to your coworkers, you are allowed to run an election without employer interference. Section 8 lists all the things that your employer can't do. They can't threaten you, they can't retaliate, they can't make promises that, oh, yeah, no, if you don't vote for the union, then we promise we'll give you a big raise. Now, the problem is that employers regularly violate these rules because they view it as the cost of doing business. And also, the NLRB, the National Labor Relations Board, which enforces the National Labor Relations Act, which is our foundational labor law has been effectively hamstrung through lack of a quorum under this
That's
administration,
one of my questions. Well, yeah, there's no quorum
lack of
right now. I don't
funding.
know if people know that.
Yeah, basically, well, right now the NLRB isn't functional at all because of shutdown, but generally it is very slow to respond, not because of the hardworking people there, but under-resourced, and then also the other side is
Very
so
much.
well-resourced that they spend massive amounts of money. As you said, one of their biggest tactics is delay. So, like, yeah, okay, we'll create a bunch of unfair labor practices. And it's going to be a year and a half until we ever hear from anyone on this.
Right.
And unfortunately, Erica, this is like part of like all labor law. There isn't really a section of the federal law that is so under enforced as labor law is. And I think that shows you about where like politicians' priorities are. It's not protecting our rights, it's protecting corporate America's rights. That said, we do have tools. And this has always been the case with the labor movement. Our strength is in our solidarity. So when an employer breaks the law, obviously you need to file an unfair labor practice. You need to call them out, but you
And how
also
do you
need
do
to
that for
unfair labor
people that
practice.
don't know? Yeah,
Yes, unfair labor practices can be filed with the National Labor Relations Board. It's actually a pretty simple process. We also have a guide on there that will take you step through step on how to file an ULP, which is an unfair labor practice. You need to present evidence, but you can file a complaint. We're also happy to connect you with folks, including in the legal field, that are experts in making sure your ULP moves forward. But there's no harm in filing a ULP for every violation that they have undertaken. You know what? If they're going to ruin your life, at least make them answer to the National Labor Relations Board. But
absolutely.
additionally, you got to take that ULP, unfair labor practice, or whatever other violations, and you've got to not only show your coworkers, but you also need to rally your community. And that's why we exist. We are there to help bring attention to this because we know no one's going to hand you a big budget to like publicize the fact that you've been attacked. And if we don't call these folks out, if we don't hold them accountable to the public, then they're just going to continue to do it. And that really is our best path right now is public scrutiny and public accountability on this and solidarity with anyone that has been retaliated against. Now, there are like interesting policies in place that would kind of make enforcement of this better. A lot of legislation's passing through the states since the federal government isn't doing their job to basically put these stronger protections in place at least state levels. And that's a great start. There are also some policies that we could put in place at the federal level that would create more protections as well for workers. But file those because you can get
You
like
can do that yourself individually.
absolutely. You do not need a law degree or anything like that. If you need assistance with it, there are plenty of resources to help with
I
that. But
have the link for that on my website as
awesome.
well, on nurseerica.com. Under the reporting tab, I have links to the top 10 reporting agencies for healthcare workers. And so there's one specific to the NLRB on there. But your website really has so many resources. I highly encourage everybody to check that out. But yeah, if you're in the process of organizing, you are not yet represented by a union. So, yeah, you should absolutely inform the union that you are trying to organize with of these ULPs when you're being retaliated against. But you don't need them to report it. You can do it yourself, right?
Yeah, absolutely. And you bring up such a great point. If you are in the process, like you don't have a union yet, or you're in the process of organizing, or you just want to engage in concerted activity, which means you and another of your coworker take action, much of that is still protected under Section 7 of the NLRA. So again, I encourage people to become familiar with it. Again, we have a very short write-up on our website that makes it accessible. But what you need to understand is if you are engaged in mutual aid or concerted activity with a fellow worker, like you walk in to the CEO's office and say, we have problems. Here are a list of demands. And there are two of you. That is protected under the NLRA, and your boss cannot fire you for that. And that's what people need to also understand is there are mechanisms in labor law that allow you to take action. Obviously, the best way is through a union. That is the most like structured and firm way that you're going to have leverage against the employer. But in the meantime, there are still tools that you can utilize as long as you're familiar with these two very short sections of labor law that are foundational to our rights. But I also want to throw in there that this isn't just federal law that protects it and state laws. This is literally part of our Constitution. It is a constitutional right to have freedom of association. And when
Yeah.
your employer starts attacking you for that, they are infringing on your rights. And when the government doesn't step up to and protect those rights, they're neglecting your rights as well. So this is foundational to who we are as a country, that for far too long, billionaires have been able to suppress that.
And that's one of the reasons I'm always harping on everyone to create their paper trail proactively, because you don't want to be in a position where all these conversations have taken place in person verbally and you have no proof of it. So be sending those summary emails every time you have a phone call conversation or an in-person conversation. Always print and save those emails at home. Keep your little journal of these things. You know, that's what's going to save you in the end, is when you can prove this retaliation takes place.
Absolutely.
But let's talk about some of the major players in the healthcare union busting industry. Can you name some of the big consulting firms? Because again, they're never called unionbusters.com, right? The big ones that the hospitals are hiring, and let's talk about what they're paying for these services.
There are a number of firms that we're very familiar with that, and they operate at different levels, but they're almost always brought in on union busting campaigns. One example, and unfortunately, Erica, two of these are former nurses.
Well, I
And
had that here because I was going through all your information and I was surprised slash not surprised, but also disgusted that two of the big union busters are nurses.
yeah, they'll use that. They'll say, as a former
Yeah,
nurse, right? Let's be honest about why they're doing it. It's dollar signs. You saw that
absolutely.
you are at the table and you saw, I can make a lot more money on the other side of this. I don't know
Yep.
any nurses that are making $500 an hour, a minimum of 8 hours of work a
Not
day
even the
plus
scabs
travel
are making
expenses.
that.
No.
And
We
we'll
are
get to them.
talking exactly. We are talking, hundreds of thousands of dollars for a single campaign. So the incentive is there if the moral compass is not, right?
Yeah.
Um, Unfortunately, we have a number of these. Like one example is Heightened Solutions, which is run by a woman named Rebecca Bannon. She's
Rebecca
a former,
Bannon. Yep.
yep,
Northwell
she's a,
Health. And she worked, I saw at Mountain View Hospital, allegedly,
that's right.
was a union buster. That's here where I am in Las Vegas.
Yeah, yeah,
This is
no,
a nurse, you guys, and she started, I believe, she's president of Solutions, this union busting firm, and she's gone out there and just absolutely wreaked havoc with hospitals around the country. Northwell Health, Concord Hospital, University of Maryland, all these places that have tried to organize. And she's a nurse. Makes me
yes,
so angry.
which is exactly what we were going to earlier, right? These folks walk in there and they say, I'm a nurse. I get it. I get what's happening. I'm here to listen. I understand. This is just not the path you want to take, which is so disingenuous because that's not why they're there. They don't care. If they cared, they'd be working on the worker side, the nurse's side of this. What they care about is that big check at the end of the day. And they won't ever tell you their true incentive. I mean, we actually have other union busters that are former union officials that will come in and say, as a former union boss, you really don't want to go with the union. You trust me, okay? What they won't disclose is why they're no longer a union in the union. And it's often because they were caught for embezzlement or they lost an
They
election
were
and have sour
fired
grapes.
or yeah,
Yes.
yeah.
So, that's valuable information to have when someone's
Yeah.
telling you don't want to be a member of the union. Again, this is why the dollar signs are also so important to this. Katie Lev is another big union buster in the healthcare industry from the Northeast to California. Another institute, these folks, almost all of them have had ULPs, unfair labor practices filed against them, violations of the Labor Management Relations Disclosure Act. I mean, we have one firm based out of Detroit, the Labor Consulting Group, which is just kind of blowing up in terms of business. So good for them, I guess. But they have been called by judges like unreliable witnesses, right? And This is literally a judge saying that, and these are the people that they're bringing in to tell you whether or not you should join a union. Also, plenty of like violations of promises and threats. But these are also, as I said, like year after year, hospitals are shelling out more for these consultants than almost any other.
Millions, millions.
Millions of
And
dollars.
and here's the thing, there's not just often one union buster per hospital. I mean, look at
Well,
Corewell
God,
Health when they were going through their campaign. Like, they had tons, multiple. And think, if you're paying all of them $500 an hour and you've got 12 of them for months on end, I mean, that's a huge amount of money.
I'm going to talk about this campaign in Iowa, which is
Yeah.
the largest campaign that has happened in there in 4 decades, I believe. 2,000 nurses at Unity Point Health in Des Moines, Iowa. Not exactly like union-friendly state in terms of the law or anything like that. They launched their own campaign, working so hard. They brought in like a small army of union busters, and of course, almost all of them, the majority of them weren't filing any disclosures. So luckily we, got in contact. We were able to figure out what's going on. But what we also did is we built a first of its kind calculator to figure out how much the hospital is really spending to fight this union drive, right? So you had the small army, I think it was around 10 union busters. You also had Littler Mendelson, the law firm. You also had they hired more labor relations staff. And then you also had the CEO involved in it. You put all of those things together within the first half of 2025, the hospital spent $6 million to fight the organizing
This
campaign,
is one
which could
hospital,
this is one. Well, sorry, they have the 3 facilities.
one healthcare system.
Yeah, Unity Point Health, and not
I'm
only
sure
did
I
they
did a
spend
video
all.
about that at some point. I'm sure I did.
Yeah, I mean, and they pulled out all the stops. I mean, like, we always know they spend a lot of money, but this is outrageous. Now, luckily, because of that work, we were able to bring some public pressure to that. Like, this is a hospital, by the way, that money could have hired, like, I think it was like 60
Tons.
nurses for 2
Yeah.
years,
Yeah.
and this is a hospital where they say patients are dying in the waiting room, for care. The
Yeah.
nurses, their demands are patient-nurse ratios, right? And a metal detector because of the number of nurses that had
Huh.
been stabbed.
Exactly.
Like, that
Yeah.
was their demands, and how did the hospital respond? They spent, by the end of it, probably $8 million
Yeah.
going after nurses. Now, God bless these nurses, because and this is everything, captive audience, at the last minute, they added 200 nurses, and they still won. Now, some votes are being challenged. Even if they lose all of those ballots that are being challenged, the majority is still there. The math just doesn't math for the hospital. They stood strong, and you should go and see some of the videos. I mean, these nurses standing outside of the CEO's office, yelling like, "You say that I'm a partner and you care about what I'm saying. Why won't you let me in the building?" And they've got
Right.
security out there, but
Right.
public knowing that they've got people in their, hospital that are dying because of a lack of care and patient care ratios. They stood with the workers. People were supportive of if they ended up walking out. And obviously, nurses don't want to do that, but it is so infuriating. The only people that most patients like in the hospital are nurses, and to find out that the hospital, instead of hiring more of them, is doing everything they can to maintain profit and control. And
Yeah.
not only should people of Des Moines be insulted by that, not only should the workers be insulted by that, but the American people as a whole should be insulted, because I wonder
Absolutely.
how much money that hospital gets in terms of Medicaid and Medicare dollars, our tax dollars,
Exactly.
that, and how much of that was used to compensate union busters instead of patient care.
I want to call out one more alleged union buster that's a nurse because I'm petty and they deserve to be called out. Allegedly, Marla Barty, president of Barty Education Services in Florida, focuses specifically on the healthcare industry. She's an RN, according to her LinkedIn, still working as a nurse in Florida and even a CPR instructor. So they're out there amongst us, you guys. Just be aware. Hopping in with a quick note. If you've seen the red and black awareness ribbons for healthcare worker violence, that's me. I co-created those with my good friend. They're now worn by healthcare workers around the world to bring much needed education to this critical issue. This is a passion project for me. It's not a moneymaker, believe me. I personally package and mail every single order from my Etsy store at the Nurse Erica. I've got enamel pins, badge reels, stickers, bumper stickers, keychains, and now the long awaited t shirts, everything that you guys have requested, all designed to raise awareness for violence against healthcare workers. And if you're interested in ordering in bulk, just email me directly. I'm happy to discount bulk orders. I've had a few hospitals order in really large quantities, and that is so exciting to me. So please check out my Etsy shop at the Nurse Erica. Now let's get back to the conversation. But I wanted to talk for a minute about LM20 forms because your team has done amazing work combing through those filed with the Department of Labor. For the healthcare workers who may not know, can you tell us what are those forms, the LM20s, and how can they use them to see if their employer has hired union busting consultants?
Yeah. So the LM20, which what you can think of is that is the first disclosure that a union buster is legally required to file with the Department of Labor. If as soon as they get engaged by an employer, so I'm a union buster, employer calls me, wants to bring me in, I have 30 days to report that to the Department of Labor. Obviously, I think that that's an old, outdated timeline. Now everything's electronic. We should shorten that timeline. That said, that's what the rule is. And the purpose is to make sure that workers have this information in a timely manner so that before they vote on election or whatever it is, they have the information they're entitled to. A few years ago, we did the first of its kind analysis of this. Turns out only 20% of union busters actually file this on time. They're intentionally holding on to it or it's just simply
Of
ignoring
course.
the rules. We had one union buster, the Labor Pros, based in Orlando, Florida. We filed complaints. We're like, we know these guys aren't filing anything. And then one night they submitted like 3 years of disclosures to the
Oh
department.
my
That's
God.
how late things can be. Again, a perfect system is union busters disclose, workers go to the Department of Labor's Office of Labor Management Standards and search their database for their employer and it pops up, right? And so they can see this is who they've hired, this is how much they're getting paid, and here are the details of what they're being paid to do. Now, again, over 80% of those that are filed, including I think we've looked at over 100 in the first month of this year, vast majority of them are either delinquent or deficient. And what I mean by deficient is like they're supposed to put in the terms and conditions of their employment, right? Like what they're doing, for how long, and why. Often they'll put verbal agreement in there. Tell me how many companies engage in verbal agreements with $100,000,
Yeah,
I
no.
don't think so, right? So this just shows how unserious the Department of Labor is about tackling. Again, that's why we started LaborLab. We have collected almost examples from almost every union buster out there of what their contracts look like. So even if they think they can get away with not sharing that information, we usually have at least a majority of that information we can share with you. So back to your question, the LM20 is really your immediate, oh man, they've hired someone outside to come in here. And in the perfect system, full disclosure. And you can go to the Office of Labor Management Standards and search that. Also, one thing that we really try to do here is workers that are organizing have enough on their plate. So if you need help finding this, you shoot us an email and say, hey, I work here. Do you know if they filed anything? We will take care of that for you and
That's so
get back to
nice.
you very, very quickly with anything we have on that. So because it's a clunky system. It's not very user
Yeah.
friendly. We're actually hopefully going to be creating our own database that is
Oh,
publicly
nice.
searchable. But in the meantime, we are a public service. Um, Contact us. We will get that information to you. And luckily, even if they're not disclosing it, we probably have publicly available information on that put into a report that we can send your way.
What are some of the mistakes that workers should try to avoid if they're in the process of trying to organize or considering organizing with a union? What can we do? I'll tell you, and you tell me if you
Yeah.
disagree with this. What I
Yep.
tell nurses all the time, and this is just kind of my own thought, I didn't get this from anywhere, but it seems to me like one of the areas where employers get us is by claiming that we are discussing organizing at inappropriate locations or times, right? So it says it cannot be a patient care area. Well, then they try to manipulate it and say, but the nurse's station is a patient care area because, or you can do it on your break if you're clocked out, but not here, to avoid that and the manipulation, because they'll lie and say that we're breaking rules even when we aren't. They just do that. It's part of the union busting. So I always say, as much as you can, try to do it, even though you're absolutely allowed to discuss it at work. Try to do it outside of work, outside of the unit, as much as you can. Try to be not clocked in. Try to be at least maybe in the cafeteria or something, to avoid them manipulating it. I don't know. What do you think?
Yeah, I think that is such a key part of it. I mean, again, in a perfect world, you should be able to scream at the top of your lungs, "I'm thinking of starting a union in your
Yeah.
workplace," because that is
Yeah.
right. Fortunately, we don't operate in that world. And one of the things that we do see happen is employees start talking about it and then it actually gets to the employer before they're ready to actually start signing
Yes.
cards, something like
Almost
that. And
always.
they will yeah, and they will respond with scorched earth. So you
Yep.
have to be smart, you have to be strategic about it. Absolutely, where you have these conversations, how you have these conversations, who you are choose to talk to. I mean, it's going to be very important for you to bring in the people that are undecided, but also be clear, you don't want
You
necessarily
don't
manage
want Becky the
or
brown noser that runs to your
you said it.
manager with everything, right? So maybe
Yep.
let's not include Becky in these
Yeah,
conversations.
exactly.
Start with a trusted coworker, right? And go try to keep it on the down low as long as possible. The employer is inevitably going to find out eventually, but
Yes.
try to keep it on the down low as long as you can because you'll make more headway before they, like you said, start scorched earth on you.
And and so many times employers, one of their tactics is they'll say, "We're a family. We're like,
Oh, yes,
be a
all the
trader,
time.
we're a family."
Yeah.
That also is important because no matter what your relationship is with them, the moment that you let them know that an organizing campaign is taking place, you have lost some level of control because no matter how
Yes.
much you may trust your employer or maybe want to like bring them in on the discussion, you give them the ability to start a union busting campaign almost
Yeah.
right away before you've even had a chance to have an honest and open conversation with your coworkers.
And
And
when they
then
find
your life's
out
going to get a lot harder.
Yes, and when they find out, they'll often, along with what you said about "we are a family," they'll suddenly give you a small market adjustment, a little bit of a bump in wages. Suddenly, your manager is gonna be way more accommodating with scheduling, approving PTOs, increased staffing, because they want you to let your guard down. They want you to say, "Well, it's really not that bad, like, it's getting better. They're listening to us." That
Right.
is just temporary. Trust and believe. They will
Yep.
go right back to the way that it was.
Absolutely, and, for example, there's, union buster in the healthcare industry, Deborah Long is, with Healthcare Labor Solutions, I believe,
Okay.
and, like, one of the main tactics that she will use when she's brought in is to say, "Hey, if you guys step forward on this, the union staff are coming in and they're gonna start knocking on your door and violating your, like, privacy, and the
Oh, yeah.
harassment's going
The
to
threat
begin."
that the union's gonna show up at your door. When does that ever happen? Who came up with
Exactly.
that? I've never seen a union come to the front door, ever.
You
Like,
know who's
that's
actually going to
so.
harass you? Your
Yeah,
employer.
and the
The
employer.
emails, the texts, all of that's about to happen, but you allow them to frame the union before you frame it to your, coworkers and actually tell them the truth about it, you've
Yeah.
lost some leverage there, and again, if you're ever facing, like, Deborah Law or something like that, let us know because we know what the tactics are, especially when it comes to, nurses as well.
Yeah. With the current political climate and potential changes with the NLRB, what should we know as healthcare workers about organizing, how it might be affected? And I know we touched on it, but can you explain the ramifications of not having a quorum to those who may not? understand.
Yeah, absolutely. So the National Labor Relations Board is a five-board institution, and it needs enough board members to actually make decisions on big cases with the NLRB. So if your rights have been violated and it goes all the way to the board, without a board there, there's no decision, which basically means the employer has essentially won, right? Because the status quo remains, which is exactly what they want to do, is just protect the status quo. Now, why is that so important? I mean, it's clear. Like, look what's happening nationally. We have companies like SpaceX and Trader Joe's, and now ACLU's even joined in to challenge the constitutionality of the NLRB.
What?
Why? Yes,
The
it's pretty.
ACLU?
Fortunately, Erica, yeah,
We're living
they
in another dimension. Are you kidding me? I didn't know
Yeah,
that.
yeah, there's this great publication called NLRB Edge. I just wanna give them a shout out, that has a great piece up last week about how the ACLU has joined in on, the case, that SpaceX, so Elon Musk, SpaceX, Trader Joe's have all brought and Tesla have all brought forward, basically saying that the NLRB's judicial system is unconstitutional. Now, that gone, there's literally like almost no avenue for workers to work through the system to have their grievances. Now, I think this is actually a really reckless strategy from the billionaire class because what was it like before we had the NLRA and NLRB? That was actually to bring labor peace into this country, where there was actually a judicial way to address workplace matters. Because before that, we're talking general strikes and people walking off the jobs and labor unrest. So, be careful. You reap what you sow on this matter. But without a quorum, major decisions are not going to be made. That said, there are still decisions that can be made because there are judges at different levels that can help with that. But again, labor law has never been on workers' side, unfortunately, whether it's how it's written or how it's enforced. But we now live in a time where corporations don't even have to pretend to play by the rules. No one's going to hold you accountable. The only people that are going to hold you accountable, though, are us. It's the people, just like how it's always been with labor law and labor rights. It's when people rise up and say, like, enough is enough on this, because it's not a judge that's going to win your union election for you. It is you all standing together and bringing your community together, fellow faith leaders, other unions, other coalition members in to stand with you. There's nothing more beautiful than in my community when there was a nurses campaign and the yard signs that are up everywhere saying,
Oh, I love that. I love that.
yeah. Because guess
Yeah,
what? The UOPs that the union's filing are not going to win that election, right? But what is the rage and anger of that community on behalf of again, there are there are basically two professions in this country that people love. It's nursing and teaching. And those are
yeah.
mission driven jobs that
And female
people support.
dominated and victimized.
Absolutely. When they stand together, almost always the community stands with them because, again, when you're in a hospital, who are the people that make the difference? It's the nurses. Nurses are
Absolutely.
the ones that, get the thank you cards. When I've had family members in the hospital, it was the nurses that gave my family a sense of like hope,
Mhm.
control, like we
Yeah,
actually had an idea of what was happening, compassion. So these hospitals think they can get away with beating up on these workers because predominantly female professions. On top of it, know that nurses go into it because they care about people and they try to exploit all of these power structures to keep nurses down and overworked and exhausted and run them into the ground.
absolutely. All of this to say this is yet another reason we need to get the PROAct passed. That stands for Protecting the Right to Organize, and it would expand workers' rights for unionization and bargaining. So if it were to pass, how would it change the landscape for healthcare workers or any workers really trying to organize?
The entire playbook to fight organizing, one of the ones that we haven't talked about is delay. And delay is a number one tactic. You touched on it earlier in this conversation, but the law firm comes in and delays the vote as long as possible. because the longer the campaign drags on, the more likely are to have alarm fatigue, right? So that's the first tactic. And then even if you do win your election, they'll drag out the contract as long as possible. I mean, look what Starbucks is doing. It's been 4 years, and a lot of
Yeah.
those workers don't have a contract yet. Why? Because they know if they can delay, they deflate and demoralize workers into the point where they don't a lot of them finally just give up and leave the workplace. Then you can do a decertification campaign because you have a whole bunch of new workers there that aren't familiar with the problems. I mean, delay, delay, delay is such a big part of it. And the PROAct, I think one of the most important things that it would do was force a contract to be settled within a year, and that is so powerful. Not only does it make organizing, I don't want to say easier, it makes organizing the way it's supposed to be, like under the law, right? It
Yeah.
is incredibly difficult. More than 60 million Americans want to be a member of a union, but only what 9% private sector, even lower than that now are members. And it's all this delay stuff. So it makes it easier, and then you actually get to a contract. So the reason that workers have rights is so that they can actually exercise them. But I'd say like not speeding up the process, but actually making the process work so that these expensive lawyers can't keep dragging it out is incredibly important. That's one of the parts that I'd be most excited about. Then also additionally, penalties for union
Yeah.
busting. Federal dollars shouldn't be used for union busting. I also don't think that fancy lawyers should be able to hide behind loopholes and things like
Yeah.
that. But yeah, those are the kind of top things that I would be most excited about if we ever pass that.
Yeah. So pressure your representatives to support the PRO Act. I think it's been reintroduced a couple of times,
Yes.
but that would be a game changer, absolutely. We're seeing massive consolidation in healthcare with hospital mergers, private equity buyouts, healthcare systems being acquired by larger corporations like United Healthcare buying Optum Care, all of that. How does this, or does it, these consolidations affect healthcare workers' ability to organize?
I mean, one thing's interesting about this is that, all of this consolidation that's happening across the country, especially in the healthcare industry, is they'll consolidate. And so you'd think that it'd make it easier to organize because you have everyone under like one umbrella. But first, they'll
Right.
continue to misclassify workers or say, actually, that's not my employee over there. So that part of the delay tactic of who actually works for who and all of that stuff. But also, there's a reason the consolidation's happening, right? Like it's about bottom lines, and they're becoming even more profit driven, which means even more against investing in nurses and patient care. And you have all of these resources consolidated in one place, probably thousands of miles from where you actually provide care, but they're willing to invest insane amounts of money against organizing campaigns. And we've seen this happen with private equity. Anything they start to touch becomes a really tough place to organize. But the consolidation piece, I'd say the biggest is it structurally can kind of make it hard. But then also, I hate to use this example, but it's like Amazon. You're fighting like the massive
This
behemoth that
giant,
employs a huge number of people. Yeah.
yeah,
And
that have
it,
more
it,
money than God. Let's talk about one of my favorite subjects, strikes and scabs as well. We've seen a huge uptick in strikes with healthcare workers, especially over the last 6 years. University Medical Center in New Orleans been on strike multiple times. Right now, we've got 15,000 NISNA nurses in New York, 31,000 Kaiser Permanente healthcare workers in California and Hawaii, and just countless others. What role do strikes play in the broader organizing movement?
I have to say, I think strikes are one of the most powerful tools we have as the working class. Labor law does not, there's not the enforcement mechanisms that favors us. We know how the system works. Strikes for far too long went by the wayside and labor was afraid to utilize them. I think we've had a major wake up call. One thing that I always think about is, because we're talking about teachers and nurses, and the strikes that happened 10 years ago in red states, we're talking Arizona, West Virginia, where it was illegal for the teachers to walk out, and they still did. And they dramatically changed education policy in that state by doing it, because they cared about their students. The exact same thing applies when it comes to nurses. the only way that we're going to actually fix this healthcare system, not just working conditions, but healthcare system, is the frontline nurses that are stepping up. And I think that's why you see so much public support for nurses, because we all know that the hospital doesn't work for us, right? For far too long, we thought that like the public wasn't going to be on our side if we took a strike. That is not the case. It has been proven wrong time and time again. And if the politicians in DC are not going to put in law in place that actually makes it so we can get to a contract or make demands in the workplace, we unfortunately have to take it to the street, because that is the most
Yeah.
powerful mechanism we have. And, all of these strikes that you mentioned, they all have the same thing in common. They're almost all talking about staffing levels and
No,
patient care.
I get so frustrated when people say, "Well, why are the nurses on strike with each individual?" I'm like, "It's always the same. I don't even have to
It's
look it up. It's always the same thing, right? It's always safe staffing ratios, workplace violence protections, usually a little bit something about benefits, trying to take away their health care benefits. And then at the bottom of the list, in some, not all, it's about appropriate wages. We're not
yeah.
even getting cost of, that's it. It's always the same thing for every nursing strike, always.
Yeah.
And
And
people
even
are
the like
like appalled. Why are the nurses on strike?
even the end, what you're talking about with wages, it's not about greedy nurses. I don't think anyone in the world thinks that they're
No.
greedy nurses. It is about making sure that you can actually attract and then retain new nurses. So
Yeah.
that is part of the staffing issue and the crisis that we have. If we want more people to go into nursing, then we actually have to pay them what they are worth, which is a lot.
So
So
they'll
I'll just,
stay.
yeah, absolutely. We're seeing this happen over and over again. I don't think any nurse wants to strike, but it's a
Oh,
huge signal to the public. Like, if nurses are walking out, we already all know that our hospitals are broken, but that is a huge alarm bell for most people. Is like, oh man, it's
yeah.
so bad that this nurse who I have a personal relationship with is walking out. Man, this is a real problem. Because guess who
Yeah.
people don't trust? Hospital CEOs, right? Like,
CEOs. Yeah, the
yeah.
C-suite. Yeah.
So
Yeah. One of the most frustrating things for nurses on strike is watching their hospitals spend millions on scabs or replacement workers while claiming that they can't afford anything else. They can't afford safe staffing ratios or competitive wages. Can you explain how strike insurance works and how it enables hospitals to essentially pay scabs more than what they're refusing to pay their own experienced staff? And doesn't this prove that hospitals can afford our demands? They're just choosing to spend the money punishing us instead. This is kind of a controversial subject because for years I've been saying, hey guys, there's a thing called strike insurance that a lot of healthcare organizations have. And everyone thought I was making it up. Like it
no.
doesn't exist. So can
Yeah.
you speak to that?
It's basically, union busting insurance. Like, I
Yes.
mean, let's be very clear that replacement nurses are part of the union busting playbook, because they know that every day that they can fill your spot they're getting one day closer to keeping the status quo at the hospital, which means
Yeah.
that the CEO maintains all of the power. So strike insurance for employers is huge, because they know that they've made the conditions so bad in the workplace that there's going to be a strike. And
Eventually, they will strike. We know this, so we must get some insurance for when that inevitably happens.
I mean, if you are paying for strike insurance, you are essentially admitting that you are running a bad hospital, right?
Thank
And I don't mean
you.
about the nurses there.
Thank you.
You are admitting that you know that eventually you are going to have driven people so far into the dirt that they are going to strike, right? And it's not about like making sure that patients are cared for. It is part of making sure that they can keep folks out of the building as long
Yep,
as possible and break their will at the expense of patient outcomes, because
correct.
numerous studies have shown that these scab nurses have way worse patient outcomes than
Oh,
the
yeah,
actual nurses
and
there,
and we'll
while
get
they're
into
getting
that.
paid 2 or 3 times more, right? Like the Unity Point campaign that I was telling you about earlier. While they're out fighting on the sidewalk, literally fighting for their lives because numerous of them had been stabbed, fighting for patient care, they have replaced nurses in there making TikTok videos to
Yep,
dance. I think I saw recently on one of your pages that a replacing nurse took a picture
uh,
and was watching
watching
UFC fight.
UFC. on the work computer while
So tell
bragging
me,
about being a scab nurse at the Kaiser strike
yeah,
just a couple
so
days
you're
ago. Yeah.
bragging. What is wrong with you, right? Like, you are bragging about being a traitor to your profession
Hmm.
while making 2, 3 times as much as the people you're replacing, while taking worse care of your patients than the people that should
And
be in
putting it
there.
out there publicly. Like, how
Yes.
dumb do you have to be? But I want to just kind of circle back
Yeah,
because
please.
for years and years, I swear I was the only one in healthcare out there saying strike insurance exists. And for
Mhm.
years, I think people are finally starting to catch on. But because hospitals and healthcare organizations do not advertise it, they don't want you to know, and they never call it strike insurance. It's got all these clever names, like they
Of
never
course,
call
yeah.
themselves union busters, right? People really didn't think that this was a real thing. So it is real, right? Right,
Oh, it
Bob?
is
Please tell the people
100%,
it's
yes,
real.
very, very real. Look, like, that's how they're happy to pay these folks so much money for so long, is because they've got an insurance policy,
Yeah.
because it's worth it for a few months, because as long as they can maintain control and keep care at a minimum, that's what they're going to do. There is one answer, not a perfect answer, besides I think that maybe that should be illegal, but,
Yeah.
the other is,
Or at least disclosed publicly where we can look it
disclosure would
up
be great.
and see the terms of it because each policy is a little different. And that would be so helpful to unions to know. Like, do they have a max dollar amount on their policy, or do they have a max time limit or a max number of occurrences per year? Because we could use that information to our benefit.
All of this should be disclosed, especially institutions that receive so much taxpayer dollars. We have a right to
Yeah.
know what's going on down there. I do want to plug our union siblings in Oregon who recently passed unemployment insurance for strikers,
Yes,
which,
was that Representative Travis Nelson, who
I'm
is
actually
also
blanking
a
on his sponsor.
nurse? I had
Yes,
him
and
on
it
my
was on your show, right?
podcast. Yes.
Yes, yes, that's
Yes.
right. I want to apologize to the good representative that I do not know who the sponsor was right off the top of my back, but I do want to say that it was incredible.
It was
So if it was
huge.
him, huge, huge props, because the outcome, every state should be doing this.
Yes,
If we want this economy to start working for us, we need to make it easier for workers to say enough is enough. And
absolutely.
unemployment insurance for striking workers is, I mean,
Another
if
one.
you
Yeah, and also Travis Nelson in Oregon, same thing.
yeah,
He passed legislation. He was instrumental in that for getting
amazing.
unemployment insurance. Yeah, love him so much. All right. Let's talk about scabs. My most controversial subject that people like to rip me apart over. And it's fine because you've been doing it for 6 years and I'm going to keep talking about it till the day I die. So that's fine. But scabs, what do they actually do to patient safety? Why they're so damaging beyond just breaking our solidarity? There is a 20-year study, I've got it linked on my website, from New York that showed in-hospital mortality increases by 19.4% and 30-day readmissions increase by 6.5% during nursing strikes when cared for by scab nurses. We've seen mothers coming out to strike lines outside of the hospital reporting unsafe care from the scab nurses who basically don't even know basic pediatric or NICU procedures. We know that scabs lie about their experience, and the agencies barely have time to properly vet them, because they only have like 10 days notice or whatever, or they just don't even bother because these agencies are often very irresponsible. So
Mhm.
when these replacement workers claim that they're helping patients, that someone has to take care of the patients, how do we combat that narrative when the data shows they're literally getting patients killed?
I mean, Eric, I think you're doing it right now. I think what we have to do is bring more attention. I'm originally from a rural state, so limited options with hospitals. I'll tell you what, though, if I walked into a hospital and there were strike breaking nurses there providing care, I don't know how I would have gotten into hospital, but let's just say I got there, I would demand to go to a different hospital because of the care issues, because they
Same.
think it's a freaking joke. They love to post on, as we've talked about, social media. They're proud to jet set around the country, provide subpar care, and break
And
the will of
brag.
their fellow nurses and brag about it. And this isn't about patient care. The
Never.
strike is about patient
Never.
care. That is a
Yeah.
symptom that the healthcare system that they are striking is so broken. And all they are doing by taking these jobs and coming in there is ensuring that that hospital continues to go on a downward trajectory, because literally the strike is trying to fix that. It's trying to rectify things. It's when nurses have had enough, they're not being listened to, and their patients are dying. That's when they go out onto the street. And the moment you break a strike and you're a scab, not only are you providing poor care, but you're ensuring that that hospital is going to continue to fail. So what could have been a 2-day strike becomes another 2 decades of subpar care, right?
But
So,
it's the one thing that I cannot get through to people. Well, we're there so that you can go on strike. You couldn't go on strike if scab nurses weren't there.
oh my
And that is the exact polar opposite of the
God.
truth. And people just bury their head in the sand. I'm talking about other scabs, other healthcare workers, and the general public. Well,
Yeah.
I want a scab nurse in there if the nurses are on strike. They're letting you go on strike. No, the strike would never take place. I get so upset because it's such a simple concept and people refuse to accept it. The strike would never take place if the scabs didn't show up, period. Right?
Absolutely. Absolutely. And the issues would probably be fixed very, very quickly if the scabs didn't show up.
Yes.
Also, people need to realize that most of the time there are like emergency protocols in place here because nurses take their jobs incredibly seriously. They want to save lives, not make
Yeah.
money like these, I'll just say the scab nurses do. You are making the problem exponentially worse. Something that could easily be fixed by this one moment of leverage that could change the healthcare you and your family receive for decades to come. If you just stand in solidarity with your fellow nurses instead of crossing the picket line, you are literally making an intergenerational difference whether you go into that
Yes.
hospital or you don't. Because it's not about that month that there's a labor dispute or anything. It is years to come after this. Our healthcare system took a long time to get in the situation it is, but we can rectify it by listening to nurses. And you are essentially putting your hand over a nurse's mouth when you go in there and silencing them. And like
And you're
shame
working
on
against your own best interest if you're a
100%.
scab. Because when you put these, things in place in one area, it's inevitably going to carry over because then a rising tide raises all ships, right? You're going to have the nearby hospitals and rehabs and nursing homes and all of them expecting the same conditions, right? So you're working against your own best interest and the future of patient safety. So not only are you often endangering the patients currently that you're caring for during that strike, you are absolutely damaging the overall future of patient safety across the board.
you're
That's your
making a
legacy
hospital
if you're a scab. That is your legacy. And that's what you're going to be judged on.
you did not provide care and save someone's life over the weekend. You made sure that an entire community's healthcare system was going to continue to deteriorate. So you are literally violating your oath to take care of people because you said it perfectly, Erica. I'm not sure why I need to add legacy. That is your legacy, is a deteriorating healthcare system.
Yeah. That's it right there. I mean, because it's often not the strike itself that's impactful, but the threat of the strike action. And that's where I think this gets lost, right? Healthcare facilities must have RNs, and people want to say, what about the LPNs? No, when you talk about the verbiage, I'm not trying to exclude anyone. It's RNs that they are required to be present 24/7 by law. They're not going to risk their accreditation and have to close their doors because they don't have RNs in there. So if a hospital cannot secure enough replacement nurses, they are forced. They have literally not one other choice other than to negotiate, even if it's at the last minute, to avoid the strike in the first place. They have to then transfer patients out, and they're losing all that money. They have to cancel the surgeries, go on divert, all of the things, right? But the second that hospitals know that they've secured enough scabs, all of the motivation to negotiate evaporates, poof, vanishes like a fart in the wind. It's just immediately gone when they know that they have scabs coming. The scabs literally remove our only leverage, our most powerful tool. That's why the term scab exists. That's why it's derogatory. It's meant to be derogatory by design because There's strike breakers who undermine the workers' collective power. So, what are the most effective strategies that you've seen to combat the scab industry? Is there anything we can do? I've seen where we will picket outside the hotels when we find out where they're staying. Is there anything else that we can do that we're not doing?
I think there's two things that really come to mind. If you're organizing a campaign or you're heading towards a strike, usually this is not like, oh, everyone decided we're going to go to for a strike. Last night we got together and decided we're striking. Part of the work you need to do is exactly what you're doing right here is education and bringing in your community, not once the strike has started, but in advance of the strike. Get your local churches to understand what's going to happen to their parishioners
Well, that's a
if
good
this
idea.
hospital continues to deteriorate. Bring
Yeah.
in other coalition partners, bring in your local central labor council, educate people, word of mouth, face to face meetings. It takes a lot of work, but honestly, it's also a big part of finding out if your strike is going to be successful, because it's called a stress test. And the point is if you're able to mobilize your community leading up to a strike, it means that your strike committee is strong and probably will be successful in the strike. Those are the people that can start putting pressure on the hospital as well. So it's
That's
no
true.
longer the nurse and the hospital CEO. It's the nurses and their community. It's the nurses and the priest who also goes to Saturday brunch every weekend with one of the board members for the hospital, right?
Yeah.
We
Networking.
cannot operate in a silo or a vacuum. We have to bring in the community because it's their care as well. And again, I cannot reiterate this enough. People love nurses and they trust nurses. They're almost the only people that have universal trust most of the time by their community. And do not be afraid to ask your community to stand with you, since you have literally kept members of your community alive or been with them when they've lost loved ones, right? It's
Goodness.
okay to ask for help. And leading up to a strike, you got to engage in this education. Everything you're doing right now is such a big part of it.
Are there or have there been any efforts to target the agencies that provide replacement workers?
There have been the main place that we're seeing this, and it'll still be interesting to see where it comes out, but is actually a lot of these are owned or controlled through private equity, of course. That's always good.
Yeah.
But there are a number of wonderful organizations out there, from like the Private Equity Shareholders Project to interfaith groups, that basically are leveraging shareholder and private equity power over these agencies. I think that's just one piece of it. I think we're still in the wilderness a little bit when it comes to necessarily going after their agencies, because I think you're absolutely right. I feel like it's just starting to come into the narrative what these agencies mean for people, and I think we've got a long way to go on this. But I think corporate campaigns are powerful on that front. We'll be interested to see how we can leverage more, activist shareholders on this stuff as well. But yeah, it's a complicated one. I have not
Yeah.
seen let's bring down that agency yet, but I think we're really at the early stages of this.
Can we work together to create a database, like a do not hire list of scab nurses across the country? Can we
I mean,
develop this? I just kind of
I'd
thought of
love
this.
I think it's a great idea, Erica. Especially I'd like people to know what they're in for. They might be in a patient's bed and having some TikTok videos made, listen to a UFC fight instead of making sure they're being taken care of. We have to some work to kind of do exposés on these folks and the mentality, and basically
Yes.
bragging about the money they make. Yes, we absolutely have to do more accountability on this fact, because this is intimately important for most people.
And kind of along those lines, this is a little bit controversial, but this is really weaponized often against me. This narrative pushed by scabs, by scab agencies, by some nurses claiming that calling them quote unquote scabs is racist, particularly against Black nurses, citing that Black workers are more likely to be unionized. I mean, it just doesn't even make any sense. But this is a complete manipulation of the data and the history of organized labor, because not only has the term scab been used for well over a century across all races, all industries, to just to describe any strike breaker. But frankly, many of the most vocal anti-scab activists are Black union nurses. So it really doesn't hold water. How do we counter this bad faith argument, this disingenuous argument that's designed to, again, divide workers, create a protected class of strike breakers? Like, think about that. That makes me insane. Like, I want to bash my head into a wall. They're trying to create a protected class of scabs by claiming that it's racist. What's your take on weaponizing this, like, identity politics to undermine labor solidarity?
I mean, I have to say, I haven't heard that much, so I guess I'm lucky about the term scab. I mean, that is unfortunately, but not surprising, one of the most disingenuous arguments I've ever heard in my frickin' life, right?
Yeah.
We all
Yeah.
know that, first off, overwhelmingly, what we're seeing in interest in organizing and new organizing are from our members of the BIPOC community.
Mm-hmm.
One, and that's where we're seeing the most wage gains, all of that. The term
Yeah.
scab, I'm so sorry it's hurting your feelings,
Yeah.
but I don't
Wah,
really care.
wah.
Yeah, because you're talking about the well-being and the
The
health
tiniest violin
of the
here.
yeah, I don't they can say whatever they want. They can try to, um, turn that. I mean, that is such an unbelievable,
Isn't it
stretch.
insane? Like the mental gymnastics that you have to jump through to get
Yeah.
your mind to that
Mhm.
speaks volumes about how ignorant you are, if you
Well,
truly believe that.
and it's just that it's absolute I mean, honestly, if someone says that to you, it's like, "Oh, okay, I know that a bunch of nonsense is about to come out of your, mouth as well." You know
Right.
what is racist? Right
It's
to work
deflection.
legislation.
Yes.
Literally, anti-union right to work legislation was the brainchild and work of segregationists, right? And the
Yeah.
reason is because they know it is much more likely for there to be racial solidarity when folks are unionized. There are like multiple studies about this as well, and that did not work for their structure they wanted of the world or the economic order of the world as well. I mean, I hate to have this reaction because I'm so sorry you've had to deal with this, but it is the most ridiculous thing I
Every
have
day I'm
ever heard.
raked over the coals for this. And
I mean,
it doesn't
Scab is a
help
word
that
that
I'm
we've
like
been
the
using.
whitest person in the world, right? And so they use that against me. Erica's a racist. Erica's bullying other nurses. No, the scabs are killing our profession. Killing
Yeah.
our profession.
Also, I don't think you're bullying anyone. I think you're standing
I
up
don't
for the
either.
bullied.
Yeah.
The
Yep,
bullies are the
exactly.
people that don't give a damn about patient outcomes in the long run or their fellow professionals. The person that is actually attacking nurses is the strike breaker. No one else. That is
Correct.
the first one we should
And
be
they want
talking
to
about.
say that the real scabs are the CEOs. No, no, no. They're on another level of evil, okay? We're
Yeah.
not trying to diminish that. They're a whole
Yeah.
other demon in and of itself, right? And we recognize
Mhm.
that every single other day of the year
Yeah.
until the day the scabs show up. And now
Yes.
you are the cause of this strike moving forward. You are the reason that we are set up for failure. You and you
Mhm.
alone.
100%. So if
Makes me
anyone's
so angry.
attacking nurses or bullying anyone, it's the people that are willing to sell out their fellow nurses for a big paycheck.
Yeah, and we now have this professional scab workforce. And like, what is that going to do to us in the long term? We have nurses that have literally built their entire careers around being strike breakers. They travel strike to strike, making outrageous premium pay while undermining the entire profession and nurses everywhere. So it creates this permanent infrastructure that hospitals can rely on to break any organizing effort. I mean, how does this affect nurses' ability to ever achieve meaningful change? And what can we do, if anything, to dismantle this scab infrastructure?
Mhm. Yeah, everyone needs to make a decision. Who do they trust when it comes to healthcare? The CEO or the nurses? Okay, have you made your decision? If it's nurses, then you should oppose scab nurses and strike breakers because you are taking away all of their power. And if you support replacements, you are standing with the CEO and even more damning the status quo. You are literally embracing the system as it currently is, which is not very good, or else people wouldn't be going on strike or dying in waiting rooms.
Bob, thank you so much for your wealth of information for this valuable conversation. Before we wrap up, is there anything else that you think healthcare workers should know about their rights or organizing or what LaborLab is doing? I just learned before we started recording that your mom and sister are nurses, and that's part of the reason you're so passionate about this. I didn't know that.
Yeah, my mother-in-law and my sister. My
Okay.
mother's a teacher.
Okay.
But yes,
Yeah.
absolutely. From my experiences as a patient and as a family member, it is some of the most important work that exists on this earth. Is so important, and I am offended every day because there probably is not a week that goes by that we don't see another hospital going after nurses, and it is deeply offensive to me as a patient, as a fellow member of the labor movement, and as a taxpayer. The one thing I want to put out there is these people don't play by the rules, and the only way that we are able to hold them accountable is the eyes and ears on the ground. Obviously, our little team wishes we could be everywhere at once, but the only way that we are able to help workers get the information that they're entitled to is if we're made aware of it. If you go to our website, you can get in contact with us there, even if you suspect that a union busting campaign has started and they've hired union busters. That's how we can really, just like the strike, we have to take these matters into our own hands to hold these folks accountable. So, I really appreciate the opportunities like this because so much of what we need to do is just let people know that these resources exist so that they can access them because we've seen it turn organizing campaigns around.
Yeah, laborlab.us. You guys have to check it out. I'm low key a little bit mad that I didn't develop it myself. Cuz it's so good. It's so good. But where else can people find you?
So we are active on Instagram, Blue Sky, occasionally Twitter, and occasionally TikTok as well. I would encourage you email versus DMs, as Nurse Erica can confirm, but we are working on that as well. And that's also a great way that you can see when we are running accountability campaigns. That's where you can find out about them. Also, we have an email list that I encourage people to sign up for.
I signed
We
up
send
for
out
it and I signed up for your summit. I don't know what all it entails, but I signed up for that too.
We're bringing together, yeah, this summer in May 6th and 7th, we're having a summit to bring together some of the best organizers, legal minds, policy folks together for really a one-of-a-kind summit that is focused on holding the union busting industry accountable. It's not just a piece of the program, it is the heart of what we're doing. So, and it's open to the public.
And it's
Anyone can
virtual,
attend,
right?
and it's virtual. The reason we did that in the past, we've done these in person, but there's cost. We want to make sure that workers and organizers, grassroots can attend this. And
Yeah.
unfortunately, not a lot of people can take 2 days off of work or even a day and spend, thousands of dollars to go travel and stay someplace. So we wanted to make
Yeah.
this as accessible. And that's why it's 2 half days. So as many people can attend as possible.
Thank you so much. Thanks so much for listening to this episode of Nurses Uncorked. If you want to support the show and get exclusive perks, become a patron. You'll get patron only behind the scenes bonus episodes, early access, ad free episodes, and more. The link is in the episode description. And don't forget to follow me at the Nurse Erica on TikTok, Instagram, Facebook, and YouTube to stay connected between episodes. Until next time, stay strong and keep advocating.